Support comes from Hampton Roads Community Foundation, partnering with donors from all walks of life to improve southeastern Virginia through grants, scholarships, and leadership initiatives. Learn more at hamptonroadscf.org.
Support comes from Thomas Nelson Community College, now becoming Virginia Peninsula Community College, the first choice to start a bachelor's degree since tuition is one-third the cost of four-year schools. More at tncc.edu.
Hello, everyone. I'm Barbara Hamlee. The Virginia Department of Health is proactive in its efforts to assess the health and well-being of Virginians and to address disparities in healthcare. Up next on Another View, the results of a recent community health assessment on the peninsula and how experts are addressing inequities in mental health services, alcohol and substance abuse, and information about COVID-19, the three top areas of concern based on survey results. Cardiologist Dr. Keith Newby, that's my co-host, Another View on Health. We'll be right back after this national, regional, and local news from NPR and WHRO News.
Discussing today's topics from an African-American perspective, this is Another View.
Good afternoon, everyone, and welcome to Another View. I'm Barbara Hamlee. I've got a great show for you today. We're going to be talking about healthcare disparities, particularly on the peninsula, although the information that we will be sharing is available and good for everyone. And Dr. Keith Newby will be joining me in just a moment. But I want to tell you about a couple of things happening in the community because it is time for back to school. And so if you need some help with some supplies and so forth, there are a couple of events that are going on this weekend. So starting tomorrow, August 26th, the end of Summer Bash with Teens with a Purpose. They will be holding an event where they will have live music, art, haircuts, race to school giveaways, and resources so you can get supplies and so forth. And they also are going to have an unique mural installation in honor of those who lost loved ones to COVID-19 and an installation dedicated to those who have experienced tragic losses caused by gun violence. So we know the exhibits are called Moments That Matter. And we know that particularly in that community, that is something that is very, very important. So come on out and support them, the end of Summer Bash, and get your school supplies while you're there. And if you don't get a chance to get by a Teens with a Purpose event on Friday, Saturday, there's a back to school giveaway from 9 until 4 p.m. At the Murray Center, which is on Brambleton Avenue in Norfolk. They also will be doing free haircuts, games, face paint, bag lunches, and free school supplies. That's at First Baptist Church in partnership with Rugged Evolution Foundation. So yet another opportunity to get prepared to go back to school. And then on Sunday, August 28th from 1 until 5, the Allied Forces Family Day and Community Giveaway will be happening. They will have free food, music, school supplies, kids, goods, and housewares. This is being sponsored by the African American Historical Society of Newport News and the Jenkins Donaldson Foundation. And it will be held at King Lincoln Park, 600 Jefferson Avenue in Newport News. So lots of things happening in the 757 this weekend. So your health is dependent on a variety of factors beyond the quality of care. Is it accessible? Is it affordable? Available? The Virginia Department of Health conducted a recent health assessment covering Hampton, Poquoson, Newport News, Williamsburg, York County, and James City County. And today we will talk about the top 3 areas where they found healthcare inequities for some communities. We have a panel of experts to address mental health services, alcohol and substance abuse and use, and information about COVID-19. Please welcome to Another View, Reverend Jan Brown. She is Executive Director, Spiritworks Foundation for the Soul. How are you?
Very good. Thanks for having me.
Good. Thank you, Jan, for being here. Dr. Ryan McQueen is Chief Behavioral Health and Adolescent Adolescent Medical Director with Riverside Regional Medical Center. How are you, Dr. McQueen?
I'm doing well. Thanks for having me.
Good. Thank you so much for being with me. And Cindy Williams, Vice President and Chief Pharmacy Officer with Riverside Health System. How are you, Cindy?
I'm doing great. Thanks for having me.
Good. And of course, my co-host for Another View on Health, cardiologist and Director of Health Equity for Sentara, Dr. Keith Newby. How are you?
Thank you. I'm doing well. Thank you.
How are things?
You doing okay?
Yeah, I'm doing good. How was your vacation?
Too short. But aren't they always, though?
Absolutely.
But just listen, I get 1 week off a year, and I take that week and I run with it. So I said, but I still got to work anyway. I was doing prescription refills. I was answering emails. So, but hey.
You know what? We all have to learn how to turn it off. I'm just as guilty. So.
Well, Barbara, you and I will get it together one day, but it won't be today.
Absolutely. Absolutely. So I want to throw out to our panel first, Keith, that each of you in your own areas have seen healthcare disparities. And I wonder if you could talk about what you see as the major issue. Jan, I'm going to start with you in terms of, now we even talked about the fact that language is one of the barriers because it is no longer called substance abuse, but substance use.
Correct. So substance use, substance misuse, and then substance use disorder. And so one of the things that we say is that language matters. And in terms of just kind of the stigma, the very bottom, people don't want to get help for something. I mean, you abuse children, so I mean, those things are crimes, and this is a health issue. And so being able to really just start from there, it makes people be willing to get some help and it also moves things from more of that criminal justice system, child welfare, et cetera, to this is indeed a health issue.
We saw that really come to light in terms of the opioid crisis because prior to, particularly for African Americans and other minorities, you were criminalized for needing help.
Correct.
And then when the opioid disorder came along and it was affecting more of the majority community, then it became a health issue.
That is correct. And there's been certainly backlash because of that. And we've worked really hard for people to tell the truth and to say that is indeed what happened. And in terms of education for the Black and Brown community, it's been about saying, okay, yes, this was done. Yes, it's been acknowledged that it was done. And now let's take advantage of the resources that are there for us to be able to participate in. And we have a long way to go. I mean, I'll talk more about, the health deserts, the treatment deserts in the Black and Brown communities. So yes, those A's that you mentioned are really important.
Okay. Dr. McQueen, in terms of mental health, particularly for young people.
One of the biggest things that I noticed is access. There aren't very many child psychiatrists around. I know we talked about it a little bit before. I think in the country, there are 8,300 child psychiatrists right now. There may be 28,000 psychiatrists total. So I know if I'm trying to get to my doctor, going from my house to my doctor, I can get there. And if I drive through downtown Newport News, I don't know how many child psychiatrists are there. A lot of those kids have a hard time even getting to where we are. If I'm 15 minutes away, some of those children can't get from their home. They can't get from where they live or from school or something.
Because they don't necessarily have a parent that could take off, for example, that can bring them to receive the help. Or there may not be public transportation. There's a lot of different.
Exactly. There are a lot of different things. And we've had people call in trying to figure out how to get to the hospital. And we'll tell them, if you need to, call 911. The police can get you there, something like that. But it's not always easy for people to actually make it in to an outpatient clinic or even to the hospital.
Okay. And Cindy, your area is more information, COVID-19, vaccines, monkeypox now is coming into play here also. What are you noticing?
Yeah, so I think if I look back to COVID and specifically to the vaccine rollout, I think early on, really I saw two barriers in underserved communities potentially, or communities of color specifically. One, I think, was misinformation, and I think through the entire COVID pandemic, and I think as we look forward to monkeypox, this is something we have to be very careful about, is information was changing very rapidly, but there was a lot of misinformation. With social media, that misinformation gets spread very rapidly and very far. And so I think making sure that we are continuing to put good, actionable, accurate information in the community, whatever means that is. I know some of the things that we did from that standpoint is really engage with trusted members of the community. And that was the faith-based leaders, especially in Southeast Newport News and Hampton. And then I think the second thing that I was really concerned about early on, especially when there was a vaccine shortage, was access. And so much to what Dr. McQueen was saying, could people even get transportation into some of these vaccine clinics if they don't have cars or they don't have parents? And so, getting vaccines into the communities where people live and making them accessible, I think those were two of the big things that we saw.
Dr. Newby, I know you as Director of Health Equity with Sentara, and you're looking a lot at the South Side, but these issues are universal throughout Hampton Roads, are they not?
Absolutely. There's a lot of overlap. I personally, I don't have any one thing I think that is predominant, because there are so many things. As I'm sitting here when you asked that question, and I say, well, I could just give you a laundry list of items, because each thing is almost equally important. Yet, can you talk about access or misinformation, trust, which is a big issue, education, people understanding, what their health issues are. Now, the one thing I will say, and you know how I am, Barbara. My patients now, we get into it all the time, when they give me excuses about things. And I tell them, I get on them because I love them, and I really want to see them do well. But, when people tell me sometimes, and like access is definitely a true phenomenon. But one thing I have found, like, for example, when Pharrell was doing his thing in the Virginia Beach, people found a way to get out there. Sometimes you'll find people really want to get somewhere, they'll find a way to get there. Now, that doesn't go across all lines and all boundaries, because there are some people, I have patients that literally can't come out of the house. For whatever reason, either physical limitations or lack of transportation. So there's so many things that I think that you could attack that I wouldn't even know where to begin. But you have to start somewhere. So listen to the other guests, and their points are extremely valid. And if I always say, God bless anyone that could come up with plans and ideas and how we can make this better, because it's so much to be done. So much work to be done.
Absolutely. And speaking of making it better, audience, we are starting this conversation about health disparities, particularly on the peninsula. But we're going to be holding a conversation this evening via Zoom, sponsored by the Virginia Health Department. And my guests who are with me now, along with another guest, will be talking and answering your questions. So you need to register so that you can get the Zoom link. So if you go to tinyurl.com/VDH Speaks, meaning Virginia Department of Health Speaks. So that's tinyurl.com/VDH Speaks. And we hope that you will join us tonight at 6 p.m. Via Zoom as we continue the conversation. And I also want to throw out the phone numbers now, because I want you to call in and talk about what barriers you may face in terms of getting health care. What are things that are keeping you from becoming the most healthy person you can? 757-440-2665 or 1-800-940-2240. Those are the numbers to call to join our conversation. Jan, I want to ask you, your bio says that you are a, quote, woman with addiction and long-term recovery. And clearly, your addiction has not kept you from becoming a productive citizen. So do we look at those who are addicted incorrectly in terms of how we deal with them?
We absolutely do. So oftentimes I'll say I'm a woman with addiction and long-term recovery. And for me, it starts with the foundation of not using or misusing alcohol or drugs for more than 35 years. And because for me, it was treated as a health issue, I got the services and supports that I needed. It was also not just treated as an acute issue, it's a chronic issue. And so through time, I've also been able to get and access the services and supports that I've needed. A funny story that I often tell, going back to this notion of abuse versus use disorder and addiction. I never abused drugs. I loved drugs. I would do anything to protect my ability to use drugs. And so just kind of starting from that place it's so important because people are afraid of the criminal justice system. We work with women who are pregnant moms and parenting moms, and they're afraid that somebody's going to remove their children. It's against the law to use drugs and so they're not accessing care in the way that they need to be able to access care.
So when people look at someone who is addicted to a certain drug, what do we need to consider? Because the easy way to go is, oh, they're just a bad person. They're a bad parent. They're a bad whatever. And we write them off. So what do we need to think about in terms of ensuring that they can get the equitable help that they need?
Sure. So the basic fundamental shift has been not why are you using, it's really what causes you to do this. And that really reframes the conversation. It's like that's where things like health can come in and the social determinants of health and looking at issues around equity. What happened to this person versus what's wrong with this person? And so just starting in that place, then it creates that relationship that Dr. Newby was talking about and my colleagues have talked about, that it's all about the relationship, because if I can trust you, I'm willing to talk to you.
So, Dr. McQueen, you deal with mental health issues. In the Black community, we are famous for saying, take it to God. I'm not going in to talk to somebody. Is that changing? Is that perception shifting?
I think it is starting to change. A lot of the kids that I see, a lot of the adults that I see, they're talking about it more. The other thing that helps, too, is that you have more celebrities talking about it. You have more people on TV talking about it. So that's making parents, making guardians much more aware of what may be going on with their kids. There are a lot of kids now who come into the hospital, and we'll have family meetings with the kids and their families before they discharge. And those kids will sit there and they will tell their parents sometimes almost everything that's going on. The parents had no idea, but they feel more comfortable with it, having come into the hospital and seeing other kids talking about those things, seeing adults talking about that. And also, like I said, seeing celebrities and people on TV that they kind of connect with, talking about those issues.
Outside of the access, because we don't have enough doctors, what are some of the other disparities that you see in mental health? So
some of the other things kind of going, I know what I just said, but sometimes going the opposite way is sometimes guardians don't necessarily understand or want to know what's going on with their children. Or the biggest thing that I see sometimes, and this may be a disparity, maybe not, is that the fear that the guardians have and trying to figure out what this outcome is going to be. I've had parents on the phone, kind of raising their voice to me, talking to me about things that are going on. And then I tell them, it's like, I understand that you're fearful of what's going to happen of what could happen with your child. And they just burst out in tears because they're not exactly certain what to do.
Why are we so afraid of healing our brain as opposed to healing our arm if we break our arm? Why? Where do you think that comes from?
I think that kind of goes back to the stigma that you were talking about. It goes back to go to God with it, pull yourself up by your bootstraps. Grandma did it this way. Grandpa did it that way. I know Grandpa had these issues, but he was able to kind of function throughout life, that kind of a thing. But I know I have friends who have told me about issues in their past where when something happened to Grandpa or Grandma, he disappeared for a little while. And I was like, well, where did Grandpa go? Nobody necessarily knows, but then Grandpa came back. And he was fine.
And he was okay.
Right, and he was okay. So I think that's probably part of it.
Part of more than anything else.
Yeah.
So, Cindy, COVID-19, aren't we over it?
I'd love to say we are. I don't think we will be for a very long time. I mean, I think we're doing a better job of learning how to live with it. Maybe sometimes safer than others in learning how to live. I mean, I think, we're going to be in this type of situation, whether it's COVID or some other type of emerging, infectious disease. We're a more global economy, things that happen other parts of the world, impact us. I think the monkeypox situation is a perfect example of how, starts in one part of the world and quickly can spread because of how the barriers have come down. But I do think that we are doing a better job of learning how to live with it and get back to a normal way of life. I mean, I think one of the things for me, and I was thinking about this as I was driving over, and it was for a different reason. You may have been listening to the news, and there was a strike, I think a teacher strike in Columbus, Ohio, that pushed at the last minute kids back into virtual learning. Well, we know how difficult that is, first of all, for the kids, but for the whole family unit. I think that we've come a long way with COVID and that we are learning how to get the kids back into the classroom safely, how to get back into the office safely. But I do think we're going to have to continue to keep track of what's going on and continue to take mitigation, whether that's wearing masks, hand washing, all of those things are going to continue to be important over time.
440-2665 or 1-800-940-2240 are the numbers to call to join our conversation. David joins us from Norfolk. Hi, David. You're on the air.
Hello, Ms. Hamley. How are you doing?
I'm good.
My quick question for the whole panel is, how concerned should we be about monkeypox?
About monkeypox? Is that what you said about monkeypox? Okay. All right. Let me let Cindy answer that question.
Yeah. So, I mean, I think, monkeypox is a very different situation, obviously, than COVID just because of how it is spread. It is spread by closer personal contact. That being said, I don't know that there's enough good information out there for people to really understand that while, that is close personal contact, it can also be bed linens from someone who has been diagnosed with monkeypox. It can be, so if you're in a situation where there's communal living, are you sleeping in a bed? You think about a homeless population, you think about multi-generational households. So I do think there's maybe more of a risk than just basically saying if you don't have close sexual contact that you're not going to get it. But it's clearly not going to be, I think, the same situation with COVID. The other thing is, while it's very uncomfortable, it's a little more self-limiting. It doesn't have as many significant medical complications that would lead to death. But that being said, it is a very uncomfortable disease because of the lesions themselves. So I think I think back again to the beginning of COVID and how it sort of took us a little while to get our feet under us. I hope we've learned from that. But I just don't think there's still enough good information out in the community to really educate people for the risk and how to protect yourself.
Okay. The Richmond Health Department, there's an article in the Richmond Times-Dispatch, and they were saying that because they have so few vaccines for monkeypox, that they have an interest form that asks a lot of personal questions. And particularly since we've known now that this is a disease that is affecting disproportionately the gay community. And these questions say, do you visit sex clubs? How many sexual partners have you had in the past 3 months? Have you engaged in anonymous sex? This gentleman that the article was about decided to go to the western part of the state to get his shot because they didn't ask those questions. So are the questions that healthcare providers asking also serving as a deterrent when it comes to healthcare? I'll start with you, Cindy.
Yeah, I would say in this case, absolutely. Because I think, one of the things out of the gate we wanted to make sure we didn't do with monkeypox is to have this stigma around it. And, you think back and, I was just coming out of pharmacy school when the HIV epidemic started, when it was first diagnosed. And you think about the stigma and how that kept people from seeking care that may have made a difference. I don't think we want to go back down that path with monkeypox. And so I do think there are ways to more appropriately ask those types of questions, perhaps asking somebody just to attest, do you meet one of these categories, right? Because it can be multiple categories. It doesn't have to be that, you have frequent sexual partners or you've gone to some type of sex club. I think having more of an attestation that I meet one of these categories and letting that stand and let the person move forward would be more appropriate.
Lisa, did you see? Keith, go ahead. You want to ask a question?
No, I was just going to comment that,
Sure.
I think when you talk about monkeypox or these other, or COVID, any of these things, it kind of goes back to the basics, protecting oneself, frequent hand washing, mask wearing, if there's close personal contact or any kind of contact really for monkeypox, so that means we have to be diligent, which we were supposed to be doing anyway from COVID. So I tell people all the time when they ask me about this, I say, well, listen, think about what we're supposed to be doing. When we started this COVID process up, and at the time, and you know how this was, Barbara, because you and I used to have frequent conversations about this. People were dying left and right from COVID when it first was, coming out. I had about 20 bottles of hand sanitizer in my white coat, when I was walking. Because I was about as diligent, and my wife is like super diligent with that kind of stuff. So, it was like we were washing hands, mask wearing. We were very diligent with that. So it really kind of goes back to people not letting their guards down, which is what really happened. And it got too politicized. And it's no offense to if any politicians out there listening, this is not a target against any one person. But the bottom line is I was hearing people who weren't qualified to talk about medicine, talking about medicine. Mm-hmm. And I say that for politicians, for people in media, meaning like some of the celebrities. I'm like, you guys don't know anything about this. Be quiet. Let folks that know medicine direct this. Mm-hmm. And that was one of the things, and we talk about that issue of trust. The unfortunate reality is when you look at, if you go on the social media, there's like a million things that were anti-COVID vaccine, but you like 1,000,000 to 1. You get one positive COVID message, 1,000,000 negative ones, because all the naysayers had the mic for a while. Mm-hmm. And I think we could have done a better job, all of us in healthcare, getting out more, trying to overtake the negative with positive. Mm-hmm. And I think that really put us behind the 8 ball a little bit, and that creates that trust issue people bringing up, Tuskegee.
Yeah.
And, you hear this, but I understand it. There's no question about it. Mm-hmm. But I said, find somebody in medicine that you trust, that you really feel has your best interest at heart, and really start looking at them. Don't go to TikTok for your information. Yeah. Go to a reputable website, Mayo Clinic, these other places, or you could go UNC Chapel Hill, all these places that have reputable sites. Get your information from somewhere that they do their background research.
Mm-hmm. If you're just joining us, we're talking about combating healthcare inequities in Hampton Roads with Jan Brown, Executive Director, Spiritworks Foundation for the Soul, Dr. Ryan McQueen, Chief of Behavioral Health and Adolescent Medical Director with Riverside Regional Medical Center, Cindy Williams, Vice President and Chief Pharmacy Officer with Riverside Health System, and my co-host for Another View on Health, cardiologist and Director of Health Equity for Sentara, Dr. Keith Newby. 757-440-2665 or 1-800-940-2240 are the numbers to call to join our conversation. Raphael joins us from Newport News. Hi, Raphael. You're on the air.
Good afternoon. Thank you for taking my call. I'd like to know the panel's view on as far as what they call alternative medicine, acupuncture, herbal medicine, whatever. Is it being accepted more now as a viable medical modality as compared to pharmacology, pharmaceuticals?
Okay. Thank you for the call. We appreciate that. Cindy, you're a pharmacy expert.
Yeah, that's
pharmaceutical expert.
That's a tough question. I'm gonna also ask my co-panelists to weigh in. I think that certainly, and I would say maybe in some disease states more than others, we really have started accepting more of a non-traditional path for medical treatment. I think to our own cancer services program where we've been doing a lot of these, whether it be massage therapy, acupuncture, music therapy, a lot of different herbals and things. I do think that we are more accepting of that as part of a multifaceted treatment modality. where I think there needs to be more research when you start thinking about things such as herbals and non-traditional medications is that many of those haven't gone through the rigorous clinical trials. And so I think sometimes we find ourselves in situations, and this is speaking from a pharmacist standpoint, where we don't fully understand, because they haven't had the same rigorous clinical trials, what are going to be, not only the impacts on the individual, but I think what we see more common than not is drug-drug interactions, perhaps with other therapeutic products that they're taking. So if there was one area, and I know part of it is there's not money. I mean, how do you get funding for research? It's all about, can you make profit at the end of the day? And I hate to say that, but that's really the name of the game. I really think there needs to be ongoing evaluation of these therapies and really trying to understand not so much, the benefit, yes, but also let's make sure there's not unintended risk that we're not aware of. But I do think we are becoming more accepting of that, and I think we'll continue to see that type of alternative medicine grow.
Okay, Dr. McQueen?
Yeah, I would agree. I mean, and if I'm thinking about patients with, let's say, for instance, anxiety, massages would be helpful. Acupuncture would be helpful. We have a lot of patients that are actually using some of those modalities to kind of, go along with the treatments that we're giving. And it may keep somebody from using a medication that could be a controlled substance and then later on leading to substance use.
Okay, Jan?
Yeah, and we've absolutely been seeing it for many years. Back in the day, people always considered them more high-end treatment kind of modalities. And so, again, some of the research has been done. We want people to follow the science and to follow the evidence, as was mentioned. And yes, we see, especially when you're looking at ultimately that, substance use disorder and addiction are brain issues. So things like mindfulness and yoga and meditation and sleep hygiene and nutrition, all of those things really matter.
It all plays together.
Yeah. It's really important.
What is Spiritworks for the soul?
So Spiritworks is what's called a recovery community organization, and what we do is meet people and then kind of companion them along the way from the journey from addiction to recovery. And we work with children whose parents have addiction. We work with the individuals themselves. We work with faith leaders and communities because we know, certainly in the case of myself, but in several different types of people for whom we value, we know that recovery is not only possible, it's expected. And so if we use those same things, so our desire is to help people remove those barriers. So equity is a conversation that we have on a daily basis. What are those barriers that are keeping you from being the most productive, the most healthy that you want to be and that you can be? And so, yeah.
So in each of your disciplines, do people ask the question, what else is going on in your life as you are diagnosing or working on your specific area of expertise? Because it seems to me that particularly for minority communities, there's so much stuff happening that can directly affect your health. And I'll start with you, Dr. McQueen. Is that something that the medical profession as a whole is moving more towards, or are they resisting having to bring in these other social determinants?
I would say that they are moving in that direction. I know particularly with me and the people that I've trained, we generally ask a lot of questions around what brought you into the hospital. Somebody may come into the hospital depressed and suicidal, and then come to find out this is the anniversary of 3 years ago when their mom passed away, but nobody ever asked the question. Or maybe this was an anniversary to something a few years ago where they were in some kind of a traumatic situation, and nobody ever asked the question. So if you delve more into that background and figure out what's going on, then you can better help that person heal and move forward.
But when you hear, Cindy, people say, you know what, I only got 10 minutes per patient. I don't have time to do all that.
Yeah, I think, and of course, I'm not a frontline care provider from a medical perspective, more from a pharmacy perspective, but I'll just give you a personal, perspective. I went in for my annual physical earlier this week. And, I have a relationship with my primary care physician, which I think is important, have a relationship with somebody you trust. But, she took the time. She knows I've got some difficult things going on with my mother, who is in early stages of Alzheimer's. She knows I lost my dad last year. She knows my husband, has had a diagnosis that with a health condition. And so, she took the time as part of that physical to say, how are you doing? Right? let's forget about it. I've looked at your labs. I've looked at your blood pressure. We sort of know that piece of it. But how are you doing? And I think that's important. I mean, I really hope we get to a place where that does become more of the conversation, because I think if it isn't, you're not. You've got to understand what are those factors, because, I think about, one of the things we focus on a lot in pharmacy is really trying to manage chronic health conditions through medication. So you think about diabetics, you think about hypertension. If you've got a lot of noise going on in your life, your ability to be compliant with the medications that are going to keep you healthy is probably going to be diminished, right? Because you've got just all this noise going on, or your nutrition or whatever it is. So I think it is really important, and I really do hope we're getting to a place that's being more valued.
Keith, but when you are a private practitioner, those who have to go to public health institutions or places in order to get their help, do they have the time to ask those deeper questions, or to establish a relationship like Cindy was talking about that she has with her doctor?
Well, it's kind of tough only because of that issue and resources. A lot of places, they just don't have adequate resources. That's one of the biggest challenges I've seen with public health departments. They just don't have enough money they get from the government to help them do some of this. One of the things we're doing with Sentara that we came up with, we're doing these community care clinics, and we have one opening actually next week in Berkeley. One of the things with that we're trying to develop is a program where we look at not just like the physician or the provider seeing that patient, but we're looking at developing a program where we have mental health, we have nurses that are going to be engaging. So like an example, if I see somebody and say their blood pressure is 180 over 100, it's hard for me when I know I only have a defined amount of time to delve too deeply into what are some of those causes why their pressure's up, because, blood pressure is a multifaceted process. It could be stress, or it could be what they've eaten. So, but if you can target an individual and have one of the nurses spend that time with them to say, okay, let's start digging a little bit, try to figure out why, look at patterns and what have you, then it may allow you to be able to develop a program that would help the patient most. So that is kind of where I think it should go, so that the person gets that full. Because then you'll find, like, say, if it was a stressful situation, like they did have a mother's anniversary of a death of a loved one, or we find it's a job-related issue, then we won't overtreat a person's blood pressure, but try to help them deal with that particular piece of what they're dealing with, and hopefully that would help them with their medical problems.
Jan, people have trouble figuring out where to go.
Absolutely.
What to do. That's a barrier?
It is absolutely a barrier. So finding the right kind of support and care that somebody needs. I mean, oftentimes you hear or you watch on television, this person's going to rehab. What is rehab?
Yeah, what does that mean?
Exactly. What does it mean? And so the expectation for many people is that I'm going to go away for a certain number of days and then I'm going to come back. Well, it might be outpatient care that somebody needs. And so really it's more these days about having somebody, a clinician, determine what level of care and support that somebody needs, instead of, so often we have people who come in and say, Jan, I need to go to rehab. And I'm like, well, what makes you decide that? When did you get a comma MD after your name? And so, what we then do is we will refer or connect them to, one of the community services boards or to one of the private practitioners, so that medical diagnosis can be made. And so part of what we need to do around misinformation with substance use disorder, especially with the deadly opioids and other fentanyls, carfentanyls, and analogs that are out here, is get people into the healthcare delivery system instead of the other systems that they're going to and finding treatment for.
So what do each of you in your areas think would be, if I could turn on a magic wand, what would be a major thing that barrier that you would like to eliminate so that more people can get the help that they need? I'll start with you, Cindy.
Wow, that's a big one. And I get to be put on the spot first.
One or two,
yeah. So, I mean, I do think the issue of access and access, sort of to services sort of meeting the people where they are, right? Whether that means in their community, whether that means at the right time, whether it means with the right set of resources. I mean, I think perfect example of some of the work that Sentara is doing as far as looking at care extenders. We know there's not enough physicians. We know that we're facing an even greater shortage of physicians in the future. So how do we leverage other healthcare professionals that can be part of that care delivery team? But I think also making sure that we are cognizant in our communities that we've got access that people can get to healthcare. And whether it's substance use disorder and understanding what the resources are and making the connection, whether it's family medicine. I mean, we've recently opened a similar community clinic to Sentara and Southeast Newport News, where there may be transportation barriers. And, it historically had been just a family medicine clinic. We're bringing in prenatal care. We're bringing in obstetrics. We're bringing in dental to make sure that we can treat the whole patient.
So you're trying to be as holistic as possible.
Exactly.
Going forward. What about you, Dr. McQueen?
If I had a magic wand,
Yeah.
we'd probably have more psychiatrists. They're just not enough out there, like I was saying earlier. And then if you have those extra psychiatrists, child and adolescent psychiatrists, you can send them out in the community to where the kids or the patients are. When I was in residency and fellowship, we went to underserved clinics in various areas, underserved schools. We treated people there so that they did not have to worry about coming to the clinic. And then if it was something where they wanted to continue to follow that person, let's say they wanted to continue to follow me, and they were able to get to the clinic where I was and they could come there. But we always had people out in the community just to make things easier for patients and just to be able to treat them where they are. And then it gives you a good idea of what's going on in their community as well.
True, which is another way to tackle it. What about you, Jane?
I think I've talked about it a lot, is the misinformation and frankly, inaccurate information. The other one, I have a 6-month-old in my care, and he was born substance exposed. And people have decided that he's an addict baby or that he's an addicted baby. And so explain what for those that may not understand.
Sure. What's the difference between substance exposed as opposed to addicted?
Sure. So substance exposed means that he was exposed, in his case, to opioids in the womb, so in utero. And so the misuse, he wasn't using himself, so there's no possibility of use disorder.
So therefore, he could not be addicted.
Exactly.
That's right.
Okay. And so again, I mean, that's a classic one. And even we don't say that somebody is an alcoholic baby. We say they have fetal alcohol syndrome. So even within kind of the range of substance use disorders, there's this hierarchy of stigma and misinformation. So I think that people would actually seek healthcare services if not only they had accurate information, but those who were treating them had accurate information as well.
Speaking of those who are treating them, how did any of you go through any type of training or was there any conversation in your education in your various areas about cultural competency? Was there any discussion about how you talk to people, how you break it down so that they can understand what it is? And Keith, I'm going to start with you because you're a doctor.
Well, actually, to be honest with you, yes and no. The one thing I've learned in this life, because I see some of the younger docs, I'm not as happy with their ability to communicate as I would like to see. I think as we've gotten actually away from it, one of the other panelists earlier made a mention about like social history. We don't do a social history anymore. I mean, I still do. Because but you'll be surprised what you'll find out. But that ability I think some of it's innate. I mean, I was blessed with that, somewhat of an innate ability to know how to communicate and to be able to dig deeper without, being offensive or feel like I'm breaking someone's trust, to be able to explain to them what does hypertension really mean? How does hypertension and diabetes impact kidneys, and how this is going to lead to a long-term problem? And most of the time, if people see that you really care about them as people, you'd be surprised how your trust level can grow quickly. But if you talk to them in a way that they feel like you value them as individuals, that's when I found that many people fail because they won't develop that trust. So yes and no, I got some, but I think you'll find trial and error. You talk to people, you look at their response. If you get a positive response, you're going down the right direction. If you get a negative response, you need to try something different.
Try something else. What about you, Dr. McQueen?
Yeah, when I was in medical school, they talked about that pretty frequently from first year through fourth year, and then in residency and fellowship, we talked about it a lot just because of the communities that we were serving. So I got a pretty good amount of training on it. Mm-hmm. And then the other thing is too, is that when you're talking to patients, if you can try to build that trust or that rapport within the first few minutes, sometimes, there's information that we have to ask about. There's questions that we have to get, but you would be amazed what people will tell you. If you can if you can sit there and listen and build that trust in the beginning, people will just sit there and literally tell you their life stories if you have time for it. If you have time.
Cindy, I'm curious because you go into many different communities. Mm-hmm. You are not African American. And when you're in an African American community, is there a trust issue? Do you have, or do you have to work harder to connect?
I think it's interesting. I think when we first started doing outreach, for example, in Southeast Newport News, we first partnered with an Achievable Dreams. That was sort of how we got into that community and the faith-based communities down there. I think there was some, apprehension that maybe not the entire team that showed up was, looked like the community, right? Mm-hmm. So we did try to make sure that we had a diverse group that would show up, but, I can't change the color of my skin, but I really want to give back to that community. Sort of that partnership was my brainchild to get down into that community because I felt very strongly we needed to. So I think, again, building relationships. So one of the things early on with that effort is really linking in with the faith-based community there. I already knew several of them, so could leverage that relationship, and certainly grew to know a number of others. So I've not seen it so much as a barrier, maybe very early on, but I think the other thing, and I've made myself available whenever anybody's called to get on the media. So hopefully people also have seen me and feel that I'm giving accurate information about the pandemic. So I don't think it's been a huge barrier, but then again, maybe I've got a different perception than the individuals I've been treating. Yes.
We got about 2 minutes left, so very quickly, in each of your areas, what would you tell people? What advice would you give to people if they may be facing your particular area? So, Jan, we'll start with you with substance use.
Yes, absolutely. So if somebody is struggling themselves with substance use or a loved one, I would say reach out to Spiritworks Recovery Community Organization, reach out to your faith community. The care is available. We do know we have bias. We manage our bias, and we are here to help.
Okay. Thank you very much. That is Jan Brown, and she is the Executive Director of Spiritworks Foundation for the Soul. Dr. McQueen.
I would say communicate and seek help. There are different ways to communicate. We don't have to sit down and speak all the time. If your child is drawing and you see something that you may consider disturbing in that picture, reach out for help. You can always call RBHC, or you could walk into the emergency room and walk into RBHC, and we can be able to give you the services that you need.
That's Dr. Ryan McQueen. He is Chief of Behavioral Health and Adolescent Medical Director with Riverside Regional Medical Center. And Cindy, you have the last word before we go to Dr. Newby.
Yeah, I think seek out accurate information from experts, right? I think anytime you're dealing with, and I think, Dr. Newby made a great point earlier, don't get your medical information off of TikTok. Go and talk with a trusted healthcare provider in your community.
Okay, and that is Cindy Williams, Vice President and Chief Pharmacy Officer with Riverside Health System. Keith, we're out of time. Thank you so much as always.
All right. Well, we'll catch up next time.
Okay. All right. Thank you so much. And we'll be right back.
Hello, this is Spike Lee. What's happening? And you listen to Another View.
And welcome back. A Virginia Beach couple wants to ensure children and teens have good financial literacy. That's why Jesse and Mimi James wrote Bobo Slims, Nuggets, and Gems. Our Lisa Godley gives us an up-close look at the creators of this new children's book and the lessons they're hopeful children of all ages will learn.
When I was growing up, we really didn't have anyone to teach you about money. It was kind of like taboo in our family, if you will, to talk about money.
But Jesse James knew it was important, So after his wife Mimi published the book she'd been working on, he suggested they collaborate and write a children's book about finances.
Fast forward, 10 years later, we actually sat down last year during the pandemic, and we started to work on it, doing the outline and everything, and came up with the concept of, hey, let's try to reach kids at a young age.
Bobo Slim is from a character that I had in my screenwriting class, and he was a bully in that story. But I thought the name was so cool. I was like, we need a name that would be catchy to kids and, well, everyone else, really. And that's how we came up with Bobo Slim.
The couple's target audience is children age 5 to 13, but the book's reach is much further.
We have had some adults that have actually read the book, and they said that they've actually took some things from the book also.
I asked Mimi to share one of the lessons that Bobo Slim teaches.
Just because you see someone has something that you really desire does not mean that you need that. There's a process in waiting, and there's a blessing in waiting, because there's lessons to learn when you wait for something you actually desire that you see some others have. Because when they get older, that will diminish some of this keeping up with the Joneses. We're trying to capture the mindset of children as they're younger, because all that we see is not all that we see. There's a story behind that. Why not tell the story behind that? Even if it's true of what we're seeing, what got you there? What trials and tribulations did you have to go through to get where you are?
What you do today could help you in the future. So if you're taking care, some things now at a young age, man, how much wealth could you have in the future? So if you could get that mindset of the kids at a young age, I'm telling you, it can definitely make a difference in their life.
The couple quickly realized that Bobo had more to say than what could be found in one book. So I asked for a sneak peek of what we can expect in book 2.
Bobo actually put his thoughts into work even at school, and the principal captures it. And Bobo is going to be a key speaker at an assembly at school. So he had no intentions of doing that, but since he got this revelation, his whole being, he's just changed. His whole being. Once your mind is changed, your whole world changes.
Jesse and Mimi say during the process of creating the book, there were times when they got discouraged, but they got outside encouragement to carry on, and are glad they did.
People who actually read the book, they are saying that it's a good product and it's God-led. It's a diverse community of people, if you will, and the next book is even more diverse because it can be used by anyone. It's not an African-American thing. It's not a Caucasian thing. This is something that can be passed down to our kids and future generations. And I just wish that I would have had someone when I was a kid. I just think about how much further along I could be if we had someone to actually teach us or to kind of guide us in that direction.
For Another View, I'm Lisa Godley.
And you can find Bobo Slim's Nuggets and Gems at Amazon, Barnes & Noble, and Walmart. Or if you'd like an autographed copy, you can go to the couple's website at silentlyblessed.com. As a reminder, the Virginia Department of Health will continue this conversation on health equity tonight at 6 p.m. via Zoom. Everyone is welcome, but you need to register to get the Zoom link. Go to tinyurl.com/VDHspeaks to sign up. I'm looking forward to serving as your moderator for tonight's event. Please join us. We need your voice on ways we can make healthcare equitable for all. Next week on Another View, the plight of Black farmers in light of a recent decision by the Biden administration. Our theme music is an original composition created especially for Another View by Jay Sennett. Lisa Godley is our show producer. Todd Washburn is our audio engineer, and Dr. Barry Graham answered our phones. I'm Barbara Ham Lee. Thanks for listening, and let's get together again next Thursday at noon for Another View.
Support comes from Hampton Roads Community Foundation, carrying out your charitable wishes forever, whether it's helping shelter animals, feeding the homeless, enhancing the arts, or supporting students. Learn more at leaveabequest.org.
Support comes from Thomas Nelson Community College, now becoming Virginia Peninsula Community College, the first choice, whether starting your bachelor's degree or advancing your career. More at tncc.edu.